We were discussing about the different stages in sleep, and there are five different stages in sleep which we had studied in your last class. And today we will be discussing what is the effect of brain waves and the mental health. Now, brain waves are very much relevant to mental health because if there is any variation in brain waves, usually that will be reflected in the nature of that person or in the mood of that person. So there is a close relationship between various kind of mental disorders and brain waves. Here you can see that any kind of abnormality in brain functioning can influence the development of certain condition. A best example is the case of schizophrenia, insomnia, chronic depression, chronic pain, and sleep problems, excessive violence, aggression. All these are somehow related with the way our brain is working. For example, when certain areas of the brain are over aroused means overexcited, the individual may be experiencing too much anxiety or presence of nightmares, fearful sleep, that is, fearful dreams during the sleep, or the person may not be able to sleep properly because the sleep has different stages, as you can see in your last class that there are different stages in the sleep, and slowly, unless the person gets a good amount of delta sleep, he may not feel that he has completely relaxed. Only during the deep sleep, we are having the delta waves, the presence of delta waves. If delta waves are not occurring for a sufficient number of time, that means the quality of sleep is less, is very poor. That is the problem with the absence of delta waves. So these kind of things we can understand by checking on the pattern of brain waves. If the brain rhythms are unstable, the individual may experience obsessive compulsion and develop. Rhythm means because during morning time there is a predominance of during a certain wave. Most of the time it will be theta waves, but during sleep we are going to the mostly of the delta waves, and that is a rhythm of, or the pattern of the verbs. So if that pattern is not properly maintained, we will be having compulsion. Obsessive compulsion means a strong desire to do something, even if we don't do that, we feel too much irritated. For example, while going to the examination, if you are thinking that you need to write only with one particular pen, that is a kind of obsessive compulsion. But for some individuals, this may be of a very severe level. So then it becomes a chronic situation or a psychological situation. Then it's known as obsessive compulsion. Then some individuals, if they don't sleep well, if they don't have a proper rhythm in their sleep of different verbs, they can develop epilepsy, and some individuals can have panic attacks. Attack means the individual may be fearing some kind of psychological problem, that he may be fearing too much. That is a panic attack. That is, he may be fearing that somebody is going to attack me, or some kind of that something bad is going to happen to me. So such kind of situation may happen in certain individual. That is what we mean by the name panic attacks. Then the gamma waves cause hyperactivity in certain areas. So if you look at the different types of brain waves, here you can see that there is a gamma waves is the, here you can see that after the beta there is one more wave, that is the gamma. Gamma waves is the high intensity wave. So if there is too much amount of gamma waves, then gamma waves can show hyperactivity in the brain. When this hyperactivity is abnormally high, as in the case of schizophrenia, schizophrenia is the typical situation of what we call madness. Some people are, we say they are mad. they have some kind of psychological problem. There is a typically we call it as schizophrenia. Schizophrenia is a very extreme form of psychological madness, and some baby will be having delusions and hallucinations. Hallucination means if we are seeing a waterfall before us, and you are hearing the sound of waterfall, and if you are seeing that an ocean is before you, these are all hallucination. So saying something that is not normally present is what we mean by the name hallucination. So this kind of problems can occur in the case of certain individuals. Then there is another problem with the poor sleep is that poor sleep often result from excessive hyperactive brain waves. So if you look at the different types of brain waves, you can see that the during the sleep normally theta waves and delta waves are predominating. But if in your brain, if you are having higher amount of alpha waves, you may not be able to get good sleep. So absence of good quality sleep is mostly occurring due to the absence of theta waves and delta waves. The proper rhythm of theta waves and delta waves may not be maintaining. That will result in poor quality sleep. So in some individuals, even during sleeping, they will be a higher level of alpha waves, sometimes beta waves. So then the person cannot sleep properly. So that is one important cause of poor sleep. So hyperactive brain waves also result may be the one of the important reason for poor sleep. Then it is also recently shown to be a contributing factor for symptom. That is, if a person is not getting proper sleep, that can be a cause of schizophrenia. So, schizophrenia is an extreme form of psychological madness in which a person may be talking something which we don't understand. He may be talking about a lot of things which other people around him may not be able to understand properly. He will be behaving very violently, very aggressively. So, such kind of madness is known as a schizophrenia, and the lack of poor good quality sleep, especially lack of sleep without enough amount of delta waves, can be one reason for the presence of schizophrenia. Then research on brainwaves has shown that certain individuals may be biologically more likely to experience depression. So that is another thing that we have noticed, that you may be having noticed certain individuals are always very much depressed. There are, even without any proper reason, they feel depressed. So that may be because of the presence of variation in the brain wave there. So these individuals demonstrate a abundance of alpha wave activity in the left frontal areas of the brain. So there is a higher amount of alpha waves here. You can see that this is the alpha waves, is second type of brain, second type of waves, and in those individuals which are experiencing a chronic depression, they are showing in higher amount of alpha waves in the left frontal areas of the brain. So left frontal, that's the front part of the brain, and especially on the left side, every part of the brain has its own function, and it is controlling some part of the body or some activity of the body. So if there is a predominance of alpha wave activity in that area, in that left frontal area of the brain, that is usually expressed as a chronic depression. So that is another evidence that we got. Then there is another condition that is characterized by excess of lower frequency brain waves. It's attention deficit hyperactivity. Lower frequency brain waves means that these are the theta waves and the delta waves. So if there are these are called lower frequency brain waves. If there is not enough amount of these waves, then that will result in a situation known as attention deficit hyperactivity. Attention mean deficit mean they may not be able to attend a thing properly for a longer time. So immediately after few minutes, their attention will be deviating to something else. They cannot concentrate on a class. So they will be doing something or other. Every time they will be doing some activity. That is why it is known as a hyperactivity. So the reason is that they do not have a proper adequate amount of lower frequency waves like delta waves and theta waves. So that will also result in a problem called attention deficit hyperactivity. Then there is a neurofeedback. It's actually a treatment technique. It's a therapeutic technique that is used to monitor and change the brainwave patterns in an attempt to modify behavior and improve mental health. That is, we have already noticed that the depression is associated with a higher amount of alpha waves. So, what the doctors are now doing is that if we can reduce the amount of alpha waves in a person with a chronic depression, then we can certainly reduce the effect of this depression on that individual. So depression is always associated with the higher amount of alpha wave. So our approach is that by doing something, we are trying to reduce the amount of the percentage of alpha waves. So by reducing this amount of alpha waves, we can also control the depression that is occurring in that individual. So that kind of treatment approach is known as a neurofeedback. So it's known as a so neurofeedback is a type of technique that is usually used to modify behavior and also improve mental health. And in an individual who has a depression, for example, therapist will use sound and visual effects to reward beta waves in order to help relieve the symptoms of depression. For example, you are playing a good song to some. You are showing some good images before or some good videos the person may like. So when we are watching such videos or when we are hearing such songs, you know that there be you know everybody knows that when we are listening to certain songs, we feel quite relaxed. So songs have that effect. So like that, by artificially making the person listen to certain songs, certain type of music, or watching certain type of videos, we can improve the amount of beta waves in that person. So that is a technique used to control the symptoms of depression in certain individuals. That is a treatment approach nowadays we are using, and it is known as a neurofeedback. Now that is regarding the mental health and the brain waves. Now what is remaining is the EEG. Now, EEG, going to EEG is actually a test that dictates the abnormalities in your brain or the electrical activities of the brain. Just like ECG is measuring the electrical activity of your heart, EEG, electroencephalogram, will be dictating the abnormalities or electrical activity of your brain. And during this procedure, electrodes consist of small metal disc with the thin wires are pasted onto your scalp. Here you can see that this is a electrode, and electrode are connected with by means of wire to a dictating device, and that dictating device can dictate the amount of electric current produced by each area of the brain. So usually around 10 or 12 electrodes are placed on the head at different parts of the body. So that is a principle of that. So these electrodes detect tiny electrical charges that result from the activity of your brain cells. And what they are doing, but then what the instrument is doing, the instrument will be increasing or amplifying these electrical charges, and it's plotting as a graph on a computer screen or a recording that may be printed out on a paper. So by using a electroencephalogram, we can dictate the amount of electric current released by each part of the brain, and we can increase or amplify that, and we can get a graphical image. And so that's how EEG is functioning. So what is the importance of EEG? EEG typically evaluates around 100 pages, that is for a or 100 pages, that is a long we are taking the EEG or electrical reading of the person for some time till we are having enough amount of data or 100 pages of data or 100 pages of screen activity. Then he or she pays special attention to basic wave pattern, but also examines a brief burst of energy and response stimuli such as a flashing light. So what the person is doing, what the doc doctor will be checking is that just like ECG has a basic pattern, EEG also has a basic wave pattern. So any kind of deviation, any kind of difference from the normal pattern that is associated with one person shows that there is some kind of abnormality. So that is the usefulness of EEG. By if there is some anything wrong with that person, if his brain is not working properly, if there is some kind of cancer or some kind of growth inside the brain, if there is a stroke inside the brain, these all can change the pattern of EEG. So by simply measuring the electrical activity, we will be getting lot of information about the physiological state of the brain, how it is functioning inside that. So that is the use of EEG. Here you can see how the EEG is normally performed. Then EEG will be measuring these kind of different types of verbs also. So it is based on the study of this EEG that we are able to detect whether a person is active, sleep, or dreaming, and how active, how whether now recently EEG is also used for finding out whether a person is saying a lie. Just like in lie detector, they are also using EEG along with many other devices. Then here you can see that this is the beta waves, the delta waves, theta waves, alpha waves, and beta waves. And what is the frequency of the each type of wave? The slowest frequency is present in delta waves, and highest frequency is present in beta waves, frequency of 12 to 30 hertz. That is a type of waves that is associated with the beta waves, and the beta waves are usually occurring during normal waking state or alert, concentrating something, or we are using all the sense organs are effective. Now, the alpha waves is somewhat slower type of waves. The frequency is 9.5 to 12 hertz, much more slower than the beta waves, and it is usually happening during deep relaxation and light meditation. And we are finding this kind of sleep. Then theta waves, usually going to theta waves, during a light sleep or during a REM sleep, we can find the theta waves. Then intuition, memory, and visual imagery. When we are dreaming, also we are seeing this theta waves. Then finally, delta waves are usually associated with deep sleep. When theta waves are associated with the light sleep, whereas the delta waves are associated with deep sleep. So, when delta waves are predominating, we may not be dreaming. Dreams only occur during the time when we are in a light sleep. During a deep sleep, nobody will be dreaming. So, automatic self healing, immune system functioning. So, there is self healing of the body. The body is getting the relaxation it needs. These are taking place during the delta waves. So these are the usefulness of this EEG. Here you can find the normal pattern of EEG and what kind of waves can occur in a EEG. Now, what are the usefulness of EEG? It can detect brain tumor. It can detect any kind of damage to brain, detecting the head injury. Then it can also dictate whether any kind of diseases like encephalopathy. Encephalopathy means swelling of the brain or bulging of the brain. This is known as encephalopathy. Then encephalitis, that is also similar to encephalopathy. Here there is inflammation of the most of the time meningitis, or it's a kind of encephalitis. And these are all kind of brain disorders or brain diseases that are affecting or changing the brain wave pattern. Then stroke is what happens is that one brain vessel will be bursting or rupturing of brain blood vessel inside of the brain is known by the name stroke. Then also during sleep disorders also we can find different types of brain waves. So these are the main function or main uses of using a electroencephalography. Here you can find the pattern of brain waves produced with the electro EEG. Then there are some the EEG is used to evaluate certain type of brain disorders. For example, when epilepsy is present or seizure activity is present, will appear as rapid spiking waves on the EEG. That is, when a person is having epilepsy, these kind of pointed waves or spiking waves may appear in the EEG. So that is an indication that the person person had an epilepsy. So that is a proper way of investigating. Then people with the lesions means any kind of injury. The people with the lesions of the brain, which can be the result of cancer or cancerous growth or tumor, or also during the stroke or rupture or breaking of the blood vessel, there is a unusually slow EEG waves. That is, the EEG waves becomes very slow. Slow waves will be dominating during the case of brain cancer or other kind of stroke. And depending on the size and location of the lesion, there will be variation in the size and nature of the wave. Then there is also another important use of the EEG is that it can be used to influence the brain activity, such as Alzheimer's disease or certain type of psychological problems like psychosis and also sleep disorder. It's a sleep disorder is known as a narcolepsy. So that these are some of the important 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 benefits of using EEG. So EEG is a very non-invasive technique. It is a highly useful technique. So by the use of this kind of techniques, we can detect the different types of brain abnormalities, brain disorders, and also we can also explain how the person is dreaming, how the person is sleeping. So this kind of pictures, this kind of images will be this kind of ideas can be obtained from by using a electroencephalogram. So that is regarding the different type of brain waves and how the brain waves are influencing and different our functioning of our brain. Then we have a small slide that I will show you that slide. That is regarding the REM sleep, and regarding that's only one slide is that. So going to the REM sleep. So going to the REM sleep, you can see that in case of REM sleep, what we are seeing is that REM sleep is a stand for rapid eye movement. So during the second stage of brain, that is earlier we have seen how a REM sleep is occurring. So during the second stage of the brain, that usually this REM sleep is characterized. So REM sleep is characterized by neocortical EEG waves and similar to those observed that is during the REM sleep, even though we are lying, we will be the pattern of brain waves is very active. Also, that is why it is that is our brain. The brain is as active as while we are walking. So that is even though we are sleeping on the bed, our brain remains very active. So it's a waking like EEG activity is accompanied by atonia or paralysis of body muscle. Even though our brain is very active, in the last class also I discussed that. Even though brain is very active, muscles are in a state of atonia or paralysis, so that we cannot move our muscles. But we can say our brain is working very fast. That is why we are seeing dreams during that time. Only that muscles that allow breathing and control eye movements remain active. Except our breathing muscles and the muscles which are controlling our eyeball are active. That is why we can find a fast movement, a rapid movement of eyeball. So that is why it is known as a rapid eye movement sleep. And during REM sleep, active dreaming take place, and also the heart rate, blood pressure, body temperature becomes more variable. There is wide variation in this heart rate, blood pressure, and body temperature during the REM sleep. And usually the period of REM sleep is lasting about 10 to 15 minutes. So that it is during that is why when we are sleeping, we have only very short. We don't have a very lengthy sleep, a lengthy dream.
സാർ
What happened?
സാർ സ്ലൈഡ് കാണത്തില്ല.
സ്ലൈഡ് കാണുന്നില്ല അല്ലേ? ഓക്കെ, ഐ വിൽ ഷോ സ്ലൈഡ് ഇട്ടില്ലായിട്ടുണ്ടാവും. So during the REM sleep, there is a small slide only. So during the REM, so this is a slide that I have put. So during the REM sleep, this is what is happening. Your brain will be very active, but at the same time, your muscles are in a state of paralysis. and REM sleep is very short. It's not going to take for a longer period. Only 10 to 15 minutes the REM sleep will be lasting. For the remaining type of time, the REM, after that 15 minutes, you will be again going to the normal sleep. Then maybe after several hours, we can again have a REM sleep. So this is usually how the REM sleep is working. Importance of REM sleep is that REM sleep is associated with the dreaming. That is why REM sleep is very widely known. So that for today's class, this is we can stop with this REM sleep today, and in the next class we will be going to another area. Okay, now it is 1:30. Thank you.
Thank you, sir.